What do medical editors do, and how does it help the public?
Medical editors take drafts of medical writing and they basically work to make it clear and correct and accessible. They do that in a variety of ways. The goal is to make it so it'll be clear and useful and accessible to the users. And the users of this information are various kinds of readers who all can benefit. Some of them are health professionals, doctors, nurses, other health professionals. They're busy and they need the best information to do their work. And so helps them, helps medical researchers. Medical researchers have a lot of literature, research literature to go through. And it's important that it be clear and readable and correct. And the public too, they edit materials for the public. And so it should be easy to understand, not misleading, inviting, all those things. And so I think by helping all these readerships, it ultimately promotes the health of the public.
Hey everyone, this is Jonathan Marx from GoToHealth. I've been in healthcare communications and marketing for 25 years, sharing evidence-based information with the public and helping to promote health professionals who have important information to share. Evidence-based information is how we go to health. For 10 of those years, I was employed by the U.S. Centers for Disease Control to provide webinars on effective medical communications to the staff. My contract ended in 2025 with DOGE cutbacks and the significant workforce reduction at the CDC. Honestly, I'm disturbed about the cutbacks at the CDC, the attacks on scientific research and evidence-based medicine, and the proliferation of unproven medical claims by health officials at the highest levels in our government. I want to share with you valuable information about how medical research is done, how medical claims are proven, and how reliable medical information should be created and shared with the public. With us to talk about this today is Barbara Gastel, MD. For 10 years, Barbara and I created webinars for the U.S. Centers for Disease Control, how to best communicate medical information for public and health professional understanding. Barbara Gastel is a physician specializing in medical writing and editing. She's a professor at Texas A&M University, where she directs the Science Journalism Graduate Program and teaches at the medical school. She also teaches in the University of Chicago's Certificate Program in Medical Writing and Editing. She has worked at NIH, MIT, Peking University Health Science Center, and the University of California at San Francisco. She has received awards from the American Medical Writers Association, the Council of Science Editors, and others. Over the years, Dr. Gastel has authored or co-authored several books on communicating science and medicine. Her latest book, Medical Editing, A Guide to Learning the Craft and Building Your Career, is slated for release in December 2025. Before we get to Barbara, we're building a community of people who care about living well, aging better, and showing up for their health every day. If that's you, tap the 5 stars or give us a thumbs up on Apple Podcasts or Spotify or YouTube or wherever you're listening to us. This helps others find the space too. Thanks in advance. So welcome to the show, Barbara Gastel. How are you today?
Doing just fine. How about you?
Good. It's so good to have you here. So in your book, you describe medical editing as a helping profession. What do medical editors do, and how does it help the public?
Yes, thank you. Thanks for asking. Medical editors take drafts of medical writing and they basically work to make it clear and correct and accessible. They do that in a variety of ways. I mean, on the most basic level, they correct things like spelling and grammar and punctuation, but
Yes.
often it goes much more than that. They will, for example, try to phrase things in a clearer way. They may work to improve organization. If there seems to be information missing that the readers might want, they will suggest that it will be added. So in many ways, really the goal is to make it so it'll be clear and useful and accessible to the users. And the users of this information are various kinds of readers who all can benefit. Some of them are health professionals, doctors, nurses, other health professionals. They're busy and they need the best information to do their work. And so helps them, helps medical researchers. Medical researchers have a lot of literature, research literature to go through. And it's important that it be clear and readable and correct. And the public too, they edit materials for the public. And so it should be easy to understand, not misleading, inviting, all those things. And so I think by helping all these readerships, it ultimately promotes the health of the public.
Good. In your experience, and I'm sure you've worked with a lot of different writers, but how much experience do a lot of medical writers have in actually communicating well for whoever their audience is? In other words, how big a job is medical editing after they give you a draft, and how much work is it for you to get something published?
I would say it is all over the board. Some medical writers are very polished writers. I mean, some are editors themselves. And I mean, everything can benefit from a fresh set of eyes. But I find some writing I get needs very little polishing. Others, the other extreme, maybe someone has good ideas and good information, but really is having a lot of trouble getting it across. And, or sometimes they know how to, but they're just so busy. And so in either of those cases, a medical editor may have a lot to do. And then there's everything in between. So it's
Sure.
pretty varied.
Good. Yeah, sure. Of course. So part of your book explains how medical journal articles are edited and published. What is the process and how does it help ensure that people get sound, evidence-based medical information?
I'm glad you asked that. Let me explain the process. And Jonathan, anytime you want to chime in and ask for clarification, or if I'm giving too much detail, but the way it starts, let's say that some medical researchers have done some research and they write it up and submit it to a journal. And then the journal will be deciding whether to publish it. But it's really a quality control process. So the manuscript comes in. And first of all, there's some initial screening to see if the manuscript has potential. So on the very basic level, making sure it's a reasonable fit for a journal. For example, when I was a medical student, I was an assistant editor of a medical journal, and this was a clinical medical journal. So all the studies we published were studies on people. Sometimes someone didn't read our instructions or didn't look at the journal and would send something in that was just laboratory research, test tube research, or research on mice. And we knew no matter how good it wasn't a fit for our journal. So we just send it back and explain and so that. And so, or if doesn't follow the instructions at all, let's say it's limited to a 20-page double-spaced manuscript, and someone sends in 60 pages. So some initial screening. Some of the most competitive journals will also do initial screening to see whether it's basically exciting enough research to even be considered, or clearly solid enough research. So that's the first level of quality control. The next level, which is a big one, is peer review, which I know is something you're very familiar with, Jonathan. Peer review is basically sending the manuscript to other experts in the same field of research. And depending on the journal and the topic, they may send it to 2 or 3 or 4 reviewers, sometimes a different number. And these reviewers are mainly judging the content. They're mainly saying, is this an important topic? Did they use sound research methods to investigate it? And then for the results, are the results plausible? Is all the information that we need about the results presented? And then is it discussed? Is it interpreted in a reasonable way? And then to a small extent, is it well written? But basically, they're not literary critics. They're mainly judging the research.
Right.
And so then they will give reports to the editor of the journal or some of the editors. And the editors will have also have read the paper and have their views. And so then the editor, or often a meeting of the various editors of the journal, they will discuss the paper and say, well, what are the strengths of this paper? What are the limitations? Where should we go from here? And then the decision may be any of about 4 decisions based on this discussion. Start with the extremes. One extreme is just accept, publish exactly as it is.
Mm-hmm.
And as you know, that almost never happens because no matter how good a paper is, there's always some way that it can be improved. And when you have several experts looking at it, they'll find some. That's pretty rare. At the other extreme, the journal will decide not to publish the paper. And it may be that there are flaws in the research, or if it's a very selective journal, it may be solid research, but not a big contribution. And then they maybe suggest that they send it to maybe a less competitive journal. In between, the usual form of acceptance is a accept with revisions. We will say, we like this research, we like the paper overall, but we feel that these improvements should be made. And so then it goes back to the authors, and usually they will work on them. Sometimes there'll be some discussion with the editors. There may be something where they say, well, I see your point here, but I think there's a better way to improve it, something like that. Or sometimes there's a related possibility where they'll say, for example, well, there's a lot of information missing that we think we have. If you add the information, then we'll reconsider it, but no promises. So luckily, let's say the paper is accepted, the authors make the revision. So that's another level of quality control. And then after it's accepted, normally the paper will undergo editing, the kind of editing I talked about earlier, where at least making sure that everything is grammatical and well punctuated and the references are in the right format and things. And that in some journals, it will also be edited to make it more readable, make sure all the formatting is convenient. And then another level of quality control, normally the journal will be sort of typeset or the equivalent, and the authors and the journal editors will usually get a PDF and they'll read it over, make sure there are not typographical errors or anything, and then the article will be released. And so that's the overall process. Some journals have a somewhat different process, but that's the general concept.
So that's such an impressive list of processes that a paper goes through before it is published. And what I really want everybody to understand is compare that process with some of the things you're hearing, let's say on social media about this claim or that claim. And decisions are being made around this kind of hearsay stuff. Compare that with the process you just heard about a medical journal article gets published. It's quite impressive. There's a lot that goes behind not only the quality of the research, the structure of the research, but then the review of the research by an editor, by other experts, by the journal itself. It's quite an incredible process we have going here. So, Barbara, your book includes, and we've done a lot of work on this in the past before with the CDC, statistical material and how it's presented in medical articles. So it could be graphs, it could be tables, whatever. Your book includes some points on editing basic statistical materials in medical articles. Some of the points can also help members of the public read thoughtfully about those topics. What are some of those points?
Right. Yeah. Let me mention a few of the points. One is look at the sort of baseline numbers, not just the percentages or multipliers. As an example, let's say something says such and such will double your risk of getting this disease. Well, it depends on how important that is, what the initial rate is. If it's a disease that, let's say, 20% chance of getting, and if it doubles it to 40%, that's pretty important.
Mm-hmm.
But let's say if it's a disease that 1 in a million people get, and it doubles your risk, then you probably wouldn't worry about it if it gets up to 2 in a million.
Mm-hmm.
So,
Mm-hmm.
so one thing is sort of look at the actual numbers. I know sometimes in, let's say, drug ads, they will say something like, this drug, if you take it, you'll have only the half the risk of getting such and such. But if the risk is already very small, it may not be worth the expense and the side effects and whatever of the drug.
Right.
Let me mention a couple of things. The term statistical significance, I think that's something to look for if you're reading, but there are very technical definitions of statistical significance, but for everyday purposes, saying something is statistically significant basically translates into meaning it probably wasn't a fluke. Let's say if it seems that one treatment's better than the other, it means based on this evidence, it probably wasn't just by chance. There's probably really something there, but I'll emphasize probably because it doesn't. In medicine, there's almost never absolute proof, but statistical significance. And so statistical significance means probably a real effect or a real difference, but that doesn't always translate into clinical significance because it can be a real effect, but it may be so small that it really is not meaningful.
Mm-hmm.
And so one needs to look at the clinical significance in addition to the statistical significance.
Right. So again, I think the point here is statistical significance means there's a body of proof that shows something is either generally or absolutely true. It's not just somebody's statement or one or two persons' experience. It really is enough statistics behind all this, enough data behind all this to say, hey, we can reliably predict that if X happens, then Y is also going to happen.
Right. Or at least we'll say, let's say chances are 19 out of 20 that, or that,
Yes.
There's almost never absolute proof from like a single study.
Mm-hmm.
But let's say you have several studies and they all find statistical significance. So that's, I think, another thing for people to look for. Is this just one study in which, even if statistically significant, maybe it's an outlier,
Mm-hmm.
or are there multiple studies that tell us the same thing? But then again, it can be statistically significant, but not clinically significant. Let's say you're comparing two weight loss regimens, and on one of them, people typically lose, 20 pounds, another typically 19.
Mm-hmm.
It may be statistically significant, but is it really meaningful in everyday life? So,
right.
So I think looking for statistical significance, and particularly for multiple studies that point in the same direction, is really helpful. And another point is things are more likely to be statistically significant if they are done in large groups of people, if a study's in a large group of people. So this is a vast generalization, but typically large studies of many people, the results are more trustworthy than those of small studies, and certainly of just anecdotes like so-and-so ate so-and-so, and then their gout got better. And so something like that. So I would say beware of single anecdotes, single cases. They can be good starting points for research, but they're rarely conclusive. Usually large studies are more persuasive.
Good. And let me just underline what Barbara's talking about. And I'm talking about clinical trials here and how drugs, let's say, for example, are developed. Typically, when a new drug is coming, it's not even on the market, but when a new drug is being developed, a very small study is done to see, number one, is this drug dangerous? Does this drug have the kind of intended effect that we're hoping it will have? It's done on a small group of people, but after that study is completed, then a larger study is done. That's a phase 2 trial where it's tried on more people, right? And we see, are there side effects? Are there dangers we should understand? And then there's a third phase before a drug is released, which is really what Barbara's talking about. The drug is studied on a large group of people so that you can make statistically significant conclusions about the kind of effects or side effects this drug can have. So even in drug development, it goes through a series of studies with larger and larger groups of people to really show that there's statistical significance that the drug is going to do what it says it's going to do. So before I go on with questions, let me just tell you about...
Actually, may I say something a little more with regard to statistical significance? Another thing is absence of proof is not proof of absence. So if something isn't statistically significant, it doesn't mean necessarily that there isn't an effect. It means that an effect has not been found. And so sometimes, let's say, small studies are really incapable of finding some effects, or very unlikely they'd find an effect there. So if you see someone says, well, there wasn't any effect, one thing to check is, was it a study that was capable of finding an effect? And if it was, let's say, a very small study, it may have been incapable of finding an effect, even if it was there.
Got it. Thank you. So let me tell you about Barbara's book, which is coming out. It's called Medical Editing, a guide to learning the craft and building your career. And it's coming out in December of 2025. And if you're interested in this whole area of medical editing, I've created a special link where you can go to buy the book in advance. And you can either buy it as a physical book or as an ebook. But you can buy the book at the following website. It's bit.ly/medical-editing. That's bit.ly/medical-editing. And who's your publisher, Barbara?
It's the University of Chicago Press, and They have been wonderful to work with. And if there's anybody who didn't get that URL, just search for University of Chicago Press Medical Editing, and you'll find the book.
Good. Thank you. So, Barbara, the book notes that, like in others in medical fields, medical editors have ethical obligations. Can you tell us about those ethical obligations and what kind of ethical issues do medical editors sometimes face?
Right. Thanks for asking that too. I think one of their obligations is confidentiality. We're talking about editing, for example, medical articles before they're published. This is confidential information, so they need to be confidential about the information, and so it doesn't get out. And also confidential, not gossiping about the authors, because sometimes we have some authors who are, let's say, prominent researchers, but not very good writers. And so confidentiality is a big one. Another one is, let's say you're in an editorial office that serves, let's say, many authors, let's say at a university or a research institute. Another one is avoiding favoritism. There may be some you like and some you don't like. But you should give good service to everybody, sort of like a doctor giving good service to everybody. Another thing is avoiding conflicts of interest. Let's say someone's a freelance medical editor. Well, there might be two competing companies, but it would be a conflict of interest to do work for both of them. Another ethical obligation is, of course, to do good work, to be thorough. And just as in medicine, we say do no harm, same thing in medical editing, do no harm. And so being careful not to introduce errors. And also, important thing is, if you're not sure, ask the author. Sometimes, let's say something in a manuscript is unclear, and rather than assuming what it means and maybe changing it wrong way. Ask the author. The technical term for that is querying. So ask the author, or even if you made an edit, let's say I'm editing something of Jonathan's and I think I get the gist of it and I edit it, but I'm not sure, then I should query and say, Jonathan, does this capture what you're trying to say? Or should we word it differently? I think another obligation is to stay current, to stay up with the field, because the field of editing, like the field of medicine, keeps changing. Not only is medical knowledge changing, norms and standards in editing change, suddenly the technology changes. When I started editing, there was no such thing as editing online. We did it all on paper. And another one that will lead into talking about some of the ethical situations is I think an editor also has an obligation to educate authors who may not be aware of some of the ethical norms for medical writing.
I do want to ask you about AI, Barbara, because you're talking about technological changes. How is AI going to come into medical editing? Is it just going to replace medical editors, or what role, if any, is AI going to play in medical editing?
Yeah, good question. And it's certainly something that medical editors are discussing a lot. As I see it, and as a lot of other people see it, AI is a tool. It's not a replacement for a medical editor. I mean, it's just like editing on the computer is a tool, or other things are tools. And I see it as a tool in part that can save editors maybe some of the routine work. There are some of the routine corrections that AI can provide, and so it's a tool. But everything from AI, the editor still needs to check, make sure that it is correct. So I think it's one more thing in the editor's toolbox. It can sometimes help in brainstorming. Let's say a title of something needs improvement. You may be able to brainstorm with AI, but I don't see it as a replacement. I see it as an additional tool.
Good. So if somebody wants to become a medical editor, if they have a particular interest in this field, how do you suggest they proceed?
Right. First of all, I want to mention that medical editors come from a lot of backgrounds. I know sometimes there's debate as to, well, are editors with a science background better, or medical editors with an English background? I know medical editors with all kinds of backgrounds. Some are health professionals or scientists as training, some majored in English or journalism or other things. So what I'd say, whatever your background is, if you are interested and have a flair for this kind of thing, I think the thing then is to fill in wherever the gaps are. So if you're from, let's say, a pharmacist who wants to become a medical editor, probably know a lot about pharmacy, but maybe don't know that much about the norms for editing. So learn them. Or if you're an English or journalism major, probably learn more about medical. I mean, if someone's still in school, I would say plan your curriculum accordingly. So you have both communication kind of courses and medical kinds of courses. If you're out of school, there are lots of continuing education courses and online courses and independent reading. And there are, if someone wants a graduate program, there are a variety of graduate programs in, let's say, communication of science, including the program I direct. Also, there are some certificate programs that are online, and people anytime in their career can take them. The one I'm involved in, I do some teaching in the University of Chicago certificate program in medical writing and editing. I think that can be very helpful. And internships can be very helpful too. Doing an internship in an editorial office. And then lots of people learn on the job. That a lot of times entry level jobs in medical editing include on the job training. And then, of course, reading. I should Thank you for mentioning my book. The book is intended for prospective and beginning medical editors, and I've tried to make it almost like a course in medical editing.
Good. So what question haven't I asked, Barbara, that you would have liked me to ask, or what kind of message would you like to leave with people today?
Thank you. I guess the main message is that medical editors aren't just language polishers. They are people who are part of the team that help bring readers of various types high quality, easy to access medical information.
Good. Good. Barbara, thank you so much for being with us today. I'm so glad you've been here to enlighten us on what goes into publishing a medical publication. Thanks for being with us.
Oh, thank you so much for inviting me. I've really enjoyed this.
Good. So Barbara's latest book is Medical Editing, a guide to learning the craft and building your career. It's slated for release in December 2025. You can buy the book at the following link, which is bit.ly/medical-editing. Again, bit.ly/medical-editing. Or as Barbara mentioned, you can go to the University of Chicago Press. You can look for Barbara Gastel. You can look for medical editing, and you'll find that book. We've been talking with Dr. Barbara Gastel, MD. She's a physician specializing in medical writing and editing. She's a professor at Texas A&M University, where she directs the Science Journalism Graduate Program and teaches at the medical school. She also teaches at the University of Chicago Certificate Program in Medical Writing and Editing. This has been Jonathan Marx with GoToHealth. Thanks so much for being with us today. And remember, as we say at the end of every show, go to health. God bless. We'll see you again next time. Thanks. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.